Bien, amigas, amigos, continuamos en WSH-FM. Son las 7:30 minutos en la mañana. Hoy, como todos los jueves, a esta hora de la mañana, agradeciendo la colaboración de nuestros invitados, iniciamos el segmento de la diabetes, auspiciado por
Capital Blue Cross, y muchísimas gracias a ellos por podernos permitir hacer este segmento. Hoy contando también, como se ha hecho costumbre todos los jueves, con la colaboración de Southeast Lancaster Health Services. Hoy de ellos tenemos a la directora de la salud para la mujer, Angela Sprunger, que nos va a hablar de la diabetes gestacional. Angela, it's such a pleasure to have you here with us and to talk about this area of diabetes that might be a little less understood within our community. Gestational diabetes, what is it?
Gestational diabetes is a condition that actually affects pregnant women, but not all pregnant women. The prevalence is about 9% in pregnant women, so about 1 woman in 20 will be affected by this, and it is getting more of a problem obstetrically in Lancaster County and in the United States.
Why is it why would you call it a problem obstetrically and not just an endocrinology speaking, okay, you have diabetes and then let's keep going? What's
Well, basically what happens is that gestational diabetes is a health problem that results in like too much sugar in the bloodstream. And so the body actually produces insulin, which would normally take care of most excess sugar in the bloodstream. But with a pregnant woman, you have to deal with the baby also.
Uh-huh.
So the female body, the pregnant body, is not able to produce enough insulin, so that leaves too much too much sugar in the bloodstream, which then gets shunted to the baby.
So this is not just something that is going to affect the mother, but it is also affecting the baby.
Exactly. And so because there's too much sugar going into the baby, then it makes a very large baby.
Do we know why this happens, Angela?
Yes, we have a pretty good idea.
Okay, what is the reason?
There is a genetic component. So if I'm the pregnant woman, if it's your mother, your sister, your brother, your father has diabetes, type 1, the one that you have to have insulin, then you are at an increased genetic chance of having
gestational
Okay,
diabetes.
that's the first one. But the main reason why it's becoming a larger problem here in the Lancaster area is because of obesity. Mm-hmm. And so if your BMI is over 30,
what is BMI? Just
your basic mass index,
okay.
and so that's your height versus your weight or your girth.
Okay.
If it's over 30, you should be somewhere between 19 to 25 is normal, or 20% above average weight. If you're over 20%, then you are at risk for gestational diabetes. Your body is not would normally, in the normal sense, would produce enough insulin, but with the baby, then the demand of the baby, right? You produce too much.
So we're seeing more cases then because of obesity.
Yes, we are.
It is. Bueno, damas y caballeros, comenzando con Angela Sprunger sobre la diabetes gestacional, es obviamente un tipo de diabetes que afecta a la mujer embarazada y que desafortunadamente debido a la obesidad se ha visto un aumento aquí en Lancaster de esta diabetes. Normalmente hay un componente genético si un familiar cercano, mamá, papá, hermano, hermana, tiene diabetes tipo 1, usted tiene mayores chances de padecer de diabetes gestacional. Pero desafortunadamente debido a la obesidad se ha visto un aumento debido a que ¿qué es lo que sucede en la diabetes gestacional? Que siempre por alguna u otra razón cuando comemos dulces, cuando lo que sea, tenemos un aumento de azúcar en la sangre. ¿Qué sucede? Que nuestro páncreas produce insulina para disminuir, para controlar ese azúcar en la sangre. Cuando el cuerpo de la mujer tiene la demanda del bebé dentro, entonces esa insulina se hace insuficiente para controlar el azúcar. Esto es un problema obstétrico porque no solamente afecta a la mamá, sino que también afecta, y vamos a ver cómo afecta al bebé.
¿Solamente dura los 9 meses del embarazo o puede
Esa
luego,
es mi siguiente-
puede
esa es
luego
mi
prevalecer
siguiente.
en la madre y de la madre pasarse a la criatura? José?
Tenemos esa, that's the next thing. So is this something that as soon, always, or sometimes as soon as the baby is gone, do we see it disappear? What happens to the health of a mother and of course the health of the baby once the gestational diabetes happens during pregnancy?
Well, usually after the baby is born, then the excess demand on the female body reverts back to normal. And only just in a few cases would the diabetes continue.
Okay. So normally you
it
would
would revert
expect
back.
that it would revert back to normal.
But what we do know is that at least 30% of those women that are gestational diabetic will end up being diabetic
At some point in
at
time
some
in their
point
life.
in time. Yes. And so that's why your diet and your exercise is so important. As a young woman or a woman thinking about getting pregnant, all of this gestational diabetes plays into, and obesity plays into your fertility rates, etc., everything.
So in Southeast, once a woman has had gestational diabetes, does she immediately then become a patient that is in constant prevention state to prevent the onset of it? You keep that follow up with that patient?
Yes, when they come back in for their postpartum, if they have been gestational diabetic, then we do another sugar test to see if they have reverted back. And then we counsel them about exercise and diet control after they've had the baby. And I might want to point out that breastfeeding itself will actually burn off the calories. If you breastfeed, if you're a woman that breastfeeds, it's essentially like you're going to the gym and exercising.
It's the postpartum
right,
gym.
postpartum gym. It's a postpartum gym for at least 1 hour to 2 hours a day.
Wow.
So if you breastfeed, just by sitting there and breastfeeding your baby, you're actually burning up that much calories off of the female body and the fat off of her body. So a
Because
woman,
it takes that much energy to produce
the
the
milk.
milk.
That's exactly right.
Okay,
So
yes.
if she really wants to try to get back into form and shape, and she wants to get her diabetes to actually prevent it from happening, breastfeeding is a great option. And if you couple that with a very low carb, no fat, or little fat kind of diet, lots of water, and very good exercise, 30 to 40 minutes a day, you can prevent this from happening again.
And certainly from becoming a diabetic.
Exactly.
And later in life.
Exactly. About 75% of all adult onset diabetes is prevented by diet and exercise. And so that's really what the person wants to do with their
Tell us,
life.
please, that percentage again.
75%.
Héctor, 75% de la diabetes de adulto puede ser prevenida con dieta y ejercicio.
Con dieta y ejercicio.
Dieta y ejercicio, y una de las cosas que nos dice Ángela es que la diabetes, una vez que el parto sucede, se espera que la mayoría de estas mujeres se reviertan a la normalidad. El problema es que 30% de estas mujeres se pueden transformar en diabéticas. You said 30% of the women, right?
Can
become diabetic. 30% de estas mujeres pueden convertirse en diabéticas luego, en edad más adulta. Lo que significa que estas son mujeres que tienen que estar pendientes de su dieta y de su ejercicio. Y una de las cosas muy importantes que ella recomienda es el amamantar al bebé, que es como el ejercicio ideal del posparto, porque la energía que se necesita para producir la leche hace posible que se queme esa energía adicional que tiene el cuerpo, esa grasa adicional que tiene el cuerpo en la producción de la leche.
¿Existen algunos riesgos durante el parto en una mujer que es diagnosticada con diabetes gestacional, José?
Let's follow up then with the baby. What are the risks for the baby, whether it be during the delivery or for the health of the baby? What normally do you see happening to the baby of a mother with gestational diabetes?
That is a very good question, and thank you for asking. If a woman is uncontrolled if she is diagnosed as gestational diabetic, and she does not bother to keep her sugars under control, like I mentioned earlier, the excess sugar is dumped into the baby, and where that goes is into the abdominal girth and shoulders
Of the baby.
So with gestational diabetic babies, you can run into a baby that weighs sometimes up to 1 to 2 pounds heavier than normal, sometimes 3.
What is normal then?
Normal average weight, I believe, is about 7 pounds, 6 to 10 ounces. And so
you can have a baby that is 9, 10 pounds.
Yes, you can.
And so you're talking a very at-risk
Yes, you are.
delivery there.
And so
Yes.
because you have a normal-sized head, which is usually the largest thing that comes out, but large shoulders, large abdomen that's bigger than the head. And so you can run into problems in a vaginal birth, and you can run into the same problems in a cesarean birth, because they usually make a cut on the abdomen a certain size. So if you have a big baby, they're going to have to make a bigger one, a bigger cut, making more obstetrical future problems for the mother. It doesn't matter which way they're going to come out, you're going to run into problems.
Into problems. So definitely, now these problems are preventable again by keeping blood sugar levels at a normal state.
Exactly right.
Now, how about the possibility of that baby developing diabetes?
Yes, they are at increased risk of becoming diabetic themselves.
Now, is this as children or is this in their adult life?
Most likely, the juvenile onset diabetes is more genetically linked. But again, we're looking at this might have a genetic component to the gestational part. And so it increases the chance of surely adult onset diabetes and childhood obesity. You're already setting your child up for obesity.
And then the same way that we have obesity problems with the mother, we're having obesity problems with children. So childhood diabetes you're going to see that. Is also increased. So if this child ends up being also obese on top of having this, the child could very well be diabetic from very early age.
It's
in
certainly
today's world.
Yes,
the way today's world is working.
All of those, the diabetes is becoming almost epidemic in the U.S. with our diet and the way we've managed to eat. If we just look around even in the schools, you'll see all the sugar things, the cakes and the breads that are all there, and not really a focus on fresh fruits, fresh vegetables, lean meats. Everything's fried. All of that goes into making diabetes.
We have a saying here on the show is that we die like fish. We die by our mouths.
Yes,
it's,
like that.
we are, and we're paying the consequences. We're not watching what we eat, and we are seeing some chronically our health is just going downhill.
Yes.
Because of our eating and lack of exercise, our sedentarism. Héctor, y eso es una de las cosas. El bebé definitivamente puede terminar siendo diabético como adulto, pero desafortunadamente si el bebé de paso termina siendo obeso desde temprana edad, podemos verlo con diabetes desde muy joven. El otro problema es que el exceso de azúcar en el bebé le pasa igual que como a cualquier otra persona. Crece el bebé de más.
Le crece el abdomen,
le crecen
los hombros.
Normalmente en el parto, la parte más grande del parto es la cabeza. Una vez que la cabeza sale, el resto del cuerpo sale muy fácilmente. Pero ¿qué sucede? Que termina este bebé con los hombros incluso más grandes que la cabeza y el abdomen más grande que la cabeza y se transforma en un parto de alto riesgo, bien sea por vía vaginal e incluso por vía de cesárea. Porque la incisión tiene que ser más grande. Y eso no solamente trae problemas con ese parto, pero sino también con futuros embarazos, donde se ha creado una herida, se ha creado una debilidad en la pared del útero. So I'm guessing that you create weakness in the walls of the uterus by creating a much larger incision, which could you have there that scar tissue on the uterus that is much larger than what it would be on a regular C-section.
Yes.
So, is there anything other than the genetics? What can a woman today that is planning to have a family do to prevent this from happening to her and her baby?
That's again a wonderful question. I'm glad you asked that. Yes, we can prevent this. So young ladies, women who are really interested in having a baby, or even if you're not, your ideal is to get to an ideal body weight. And
Talk to us about the BMI again, because
Yes.
I'm crazy about calculating mine now.
Oh my,
Yes.
it's actually a sort of a convoluted mathematical
But
equation.
again,
But it's
just what you said that it was. It's 20% of your body weight is.
well, that's a classification of obesity.
Obesity, I'm sorry, yes,
20% over your ideal body weight. Your body mass index is a calculation with your height, the bone structure, and also your current weight. And so you can Google
the
it.
ideal
There's
is
apps.
19 to 25.
25, yes, is
Okay.
ideal.
But then over 30, then a
That's-
woman that has a BMI over 30 has a higher chance of
Yes.
developing gestational diabetes.
And anytime you go to a healthcare provider, they weigh you, they do your height, and they can, and you should ask perhaps, what is my BMI, and tell me about this.
Probably they haven't told me because they're being nice.
Well, I think it would show a lot of education on your side, that if you say, I would like to know my BMI, I would like to be in an average BMI, and what can I do to attain that? If you do that, you will blow your physician right off the table.
So Angela, here you're not just giving us a tool to prevent gestational diabetes or to at least know what are our chances, but also for us guys, the BMI would be important to say,
Very much so.
okay, I'm at a higher risk. So this is something that we could use across the border to say, ask what your BMI is.
Exactly.
It's body mass index.
Index.
What your body mass index is, so that you can have more control of your health.
Exactly.
It's a fantastic tool to have.
And then I think to have a goal of a very moderate amount of exercise every week, 3 to 4 times, at least 30 to 40 minutes. And you can achieve that simply by taking your sweetheart out for a nice stroll. It's beautiful right now.
With that new baby.
And the new baby,
The
or
new
pushing
baby,
the baby,
all
or
three.
taking your
Yes,
kids out.
yes.
That is a moderate amount of exercise, believe me.
When you go to the park, don't sit on the bench.
Right.
Jump,
Walk around.
Jump a little bit. Walk around with your child and
Exactly.
play with the child on the different push the child on the swing.
Exactly.
And that you're already making some effort there, right?
Yes, you are, very much so.
yes.
So it's very little to do.
Yeah.
You just need to get out and exercise and walk, and it's a great time to process life with your sweetheart and make sure that you're on the same plane emotionally and physically.
Yes.
You'll feel much better.
Absolutely.
We are what we eat.
Angela, yes, this was so good. Muy interesante, damas y caballeros. Un poco de ejercicio, un poco de vigilar lo que estamos comiendo, y con esto se puede prevenir. Damas, si usted está planificando, o incluso, como dice Angela, si no lo está planificando, es bueno para su salud, pero si usted está planificando tener una familia, el saber su índice de masa corporal, el Body Mass Index se llama en inglés, usted entonces puede tener más control. Al saber, el ideal es de 19 a 25. Si usted tiene un índice de masa corporal mayor de 30, usted está en mayor riesgo de tener diabetes gestacional, y recuerde que su historia familiar de paso también la puede afectar. Muchísimas gracias. Thank you so much, Angela, for being here with us. Agradecemos también a la gente de Capital Blue Cross por permitirnos o por facilitarnos la posibilidad de tener este segmento aquí en Café con Leche.
Y a nuestra amiga que siempre acompaña a los invitados aquí.
Nicole, thank you.
Nicole, thank you so much. You've been so quiet back there.
Yes. Thank you very much, really, to Southeast Lancaster Health Services for allowing us to have people like you, Angela, here with us and sharing with our community this important information. Continuamos con más con Café con Leche después de esta breve pausa.